need to complete last year's work, which was the minutes of last year's meeting. So we need you to approve those. And that's just for accuracy by those people that were at that meeting. So they were sent out last Friday and they are on the website. Maisie's just going to put them in the chat box as well. So if anyone has any amendments to these, would you put that in the chat box? Otherwise, we'd like you to accept those as an accurate record. Let's see.
Nothing's come in through the chat, so.
Right, thank you very much, Maisie. Thank you. So I'm going to hand you over to Vicky now, who's going to go through the highlights of our previous year. So Vicky, over to you.
Thank you, Georgie. Hi, everyone. My name is Vicky Marriott. I'm the area manager for Somerset and South Gloucestershire Healthwatch. So the annual report that we provided in June, you may have seen already, was for the year 2019 to 20. And during that year, I was just going to give you some of the sort of main things that happened. It was a sort of maybe an unusual year for us. So if we can have the next slide, Maisie. Thank you. So we provided information and signposting for 174 people. We always make a note of how many people we do that for. We engaged with people either face-to-face during our outreach activities during that year or through our digital platforms with 385 people and passed on their story. That was lower than the previous year, partly due to the fact that we were planning our bid for the new contract, and that did take up some of our time. At our AGM this time last year, we had 4 part-time staff, so we were quite low on numbers. Right now, in October 2020, we have 10 staff and 6 are part-time and 4 full-time. One's actually freelancing with us. So the other thing I was just going to briefly mention was the 3 published reports that are on the screen just mentioned there that we made recommendations about. The one with NHS England, looking at their priority areas for improvement in their long-term plan, that was called What Would You Do? That ran for 3 months. We chose to ask people about their services in North Somerset, people in particular with autism, who had experience of services for people with learning disabilities and for people with cancer. So those are the 3 areas in the long-term plan we felt were the most important in this area for us at the time. Our other 2 reports were a digital inclusion report. It was work that we've been doing in GPs, practices and libraries, face-to-face with people, giving them help to access patient bookings apps. And thirdly, we published a report about students in schools and colleges in North Somerset and their experience of mental health support. And we were really pleased, actually. That one of our recommendations in that report has influenced the recent all-age mental health strategy for the BNSSG. There'll be some money available as a result of that, some funding that's called Trailblazer funding, which will provide mental health support teams. And we look forward to our vulnerable students in schools and colleges in North Somerset sort of being able to access those mental health support practitioners in the years to come. It won't be available until next year, I think, actually. Late in 2019, finally, I was just going to mention that we formed 2 new prioritisation panels. We already had a North Somerset Prioritization Panel. Those two new ones were in Bristol and South Gloucestershire. They're made up of volunteers and staff and board members, and they met and produced work plans for 2020 with strategic relevance in each of those areas. As you can see from this graph, even before COVID, as you see in the middle, we were tending towards more digital engagement. As you can see, there was 307,000 people we engaged with, either face-to-face at FGF or through the websites and our 10 media channels. So we were already upping that engagement, and that has obviously under COVID progressed some way since then. So Facebook and Twitter in particular have allowed us to reach a lot more people across the new patches, but obviously we're aware that that doesn't mean that we reach everyone, and we are still making efforts to increase the way we engage in other ways. So I just, the next slide please, Maisie. So that's the annual report. You may have seen it. If not, you're very welcome to be sent. We've got some hard copies if you'd like one. And that gives you the whole year, and probably the area leads, Julie, Maisie, Achoma and Chile, will fill you in with a bit more detail on the projects that really started sort of earlier this year and have progressed up until now. They're going to be talking a bit later today, but thanks very much. Handing you back to Georgie. Thanks.
Thank you very much, Vicky. I don't know if, Vicky, next time you're on, you can turn your sound up a little bit.
Was I a bit low? Sorry.
Thank you. Okay, so our next presentation is from Dick Whittington, who's our treasurer, and Dick is going to give you the detail of our finances moving forward. So Dick, over to you.
There we are. Right, I busily turned my mute on and I forgot to turn it off. Sorry about that. Good evening, everybody. This won't go into too much detail, I'm afraid, because limited time. If you do have any questions, do please feel free to pop them in the chat, and I will do my best to pick up and answer. Probably not as I'm speaking, because I'm not very good at multitasking. Okay, so can we go on then, Maisie, please? So we are starting to talk about Bristol, North Somerset, South Gloucestershire, but Healthwatch North Somerset remains the legal name. So those are the names under which these accounts appear. They have gone through an independent inspection as usual, and the board has agreed them at our last meeting. But we'd like to present them to you, our members, before they're absolutely, the ink is dry, if you like, and before we send them off to the Charity Commission and indeed Company's House. Now, it was a complicated year, not least for finances. This is just one set of accounts, but please remember that the year was a year of two halves. So the first half of the year was funded by North Somerset Council as Healthwatch North Somerset. From October, we took on Bristol and South Gloucestershire as well under one contract. So the funding increased a little. Okay, if we can carry on. So this, first of all, is where the ink, oh, don't know what happened there. Can we go back to income, Maisie, if we may? Right, that's lovely. So this is just the headline numbers. I'm not expecting you to take them in, just to give an idea of scale. So you'll see that what we got from the three councils together was roughly twice what we got in the first half year from North Somerset. As well as the main funding to provide our services, we did two smallish bits of consultancy work, one for the clinical commissioning group and one for Healthwatch England. And one question you can ask me, which I'll have to get Vicky to reply to, is what exactly the consultancy was for, because it's so long ago now, it's lost in the mist of time. And because we've got some money in the bank and we've got a very good bank deal by today's standards, we got a small but useful amount of interest as well. So that was our total income. Carry on. Expenditure I've divided into direct and indirect. There's no magic to it. It's really just a way of getting them on the screen and making them visible. But as usual, the great majority of our costs are salary costs. And normally the second highest item is accommodation. The salary costs went through quite a roller coaster this year. We started off with a reasonably full complement, lost staff, and then of course we've gradually recruited, and over the last 3 months of last year we were up to full complement. The other areas where we've increased expenditures against previous years are on travel, because people are doing a lot more travelling now, or were until the middle of March. And we did quite a lot on marketing, inevitably with the launch of the new organisation, plus a lot of work to increase with website presence. Okay, so if we just move on. And these are the support costs. The largest item is office accommodation for our office in Nailsea. We've given some thought as to whether that would continue, but in practice, it is important to have an office, even in these sort of times, and it would be very disruptive, we felt, to try and move. We also spent quite a bit on IT, mostly on new equipment for the new staff team. Okay, if we can move on. So this is summarising how it all ended up, and if you just whistle down to the bottom, you'll see that in the year gone by, we made a small deficit of £4,420 odd, which was not much dissimilar to the year before, actually. So if I can move on, I'll just give a little bit of thoughts on that. Oh no, sorry, balance sheet first. How could I expect that? The only thing really I want to say about the balance sheet is the money that we've got. So our total assets, when we take account of debtors and creditors, which is perfectly normal, it was just over £53,000, which was a reasonable sum from where we came from. Okay, so we can move on. So the loss of £4,000, it was actually less than we'd expected, because we knew it was going to be a difficult year. And that in particular was because of the costs of transitioning to the new contract. So we spent something like £8,000 on human resources. That was cost of redundancy that we had to inherit from other organisations. Quite a lot of HR advice that we had to buy in, because we're a lean and mean organisation. We don't have a HR function. And then we spent quite a lot of money on publicity, launching events, and things like new IT equipment. Overall, the funding going forward is a lot less than the sum of the 3 unitary budgets that the previous Healthwatches had, which is entirely reasonable, because there clearly are economies of scale by working as one organisation. As well as that, there are also great advantages in being able to deal properly with all the health facilities that serve our area. But we knew it was going to be a very tight budget when we started. But the good news is, notwithstanding the setup costs, for the period since October of last year, and in particular from April, we are well within budget so far. But of course, there's been a couple of things in our favour. It took us a while to get up to full complement when we took over the new area. And sadly, with the pandemic, our costs in terms of things like meetings with the public and travel costs, getting out seeing people, are hugely reduced. And just nipping to the last point, where we've done an awful lot of work to try and work digitally and smarter. But I think we need to do more there, which is why we do need to spend some more money on engagement. And the good thing is that our reserves are still healthy at over £50,000. That represents something like 3 months expenditure, which for our sort of organisation is reasonable. I have to say that I wouldn't want it to go too much lower. Okay, that's all from me. As I said, if anybody's got any questions on points of detail, do pop them into the chat. Thank you. Oh, sorry, I've got one other thing I've got to do, Georgie, haven't I? Which I'd almost forgotten. Which is we do have an independent examination, which has been carried out for the last few years by Michael Bowles, who used to work for Voluntary Action North Somerset and is now a freelance supporting small businesses and voluntary sector organisations across the area. Mike is very, very approachable, very thorough. And he's also very reasonable in terms of prices. We do propose to retain his services as independent examiner for next year. I hope everybody's happy with that. If anybody's got any reservations about it, do please say in the chat. Otherwise, we will re-engage him when the time comes. Thank you.
Thank you very much, Dick. Thank you. And hopefully made what could be a quite complicated area acceptable for everyone to understand. Now, one of the most important things we need to do this evening is to go through our special resolution for a name change. We've said already that we've been operating for many years as Healthwatch North Somerset and have been successful in being contracted to deliver that service across the wider area. Our articles that allowed us to operate under Charity Commission rules needed to be changed to enable us to do that fully. And so we're asking you as our members for permission to change that name. We have already been to the Charity Commissioners and they have agreed the change. And we have also been to Healthwatch England, who are satisfied that we do this going forward. So it will amend our Articles of Association, first of all, so that beneficiaries include all residents of Bristol, North Somerset and South Gloucestershire. And we've been doing that since we took over the contract on the 1st of October, but it does mean that we are formally doing that under our Articles of Association. And then our objects will be expanded to read the advancement of health and social care and the relief of those in need by providing information and advice to the general public about local health and social care services, making the views and experiences of members of the general public known to health and social care providers, and enabling local people to have a voice in the development of and equality of access to local health and care services and facilities. And that's been changed then for the beneficiaries to include all people resident in Bristol, North Somerset and South Gloucestershire, and also to change our legal title from North Somerset to Healthwatch Bristol, North Somerset and South Gloucestershire. So we have asked you already to indicate whether you agree with that change of name and change of beneficiaries. And we have already got votes for that. But if anyone hasn't voted already and is a member and wants to vote, could you now indicate that in the chat? Thank you very much. Okay, so I think what we have there already and what's been indicated in chat. Thank you very much. Thank you. Thank you for everyone who's contacted us beforehand and those that have indicated in chat this evening. So we can now formally operate for the benefit of all residents right across BNSSG and operate formally in the name of BNSSG. So thank you very much for that. And I'm sorry we've got a number of things to put in front of you this evening, but I'm really grateful for you agreeing to that. Thank you.
Georgie, shall I go on to the next slide?
Yes, if there's some still coming in, do
No,
put them in. But I'm going to pass over to Vicky now, who's got another important bit to do, because one of the important parts of working for the wider area is to also widen our board's reach. So we're starting to do that, and I'm passing over to Vicky to do that for us, especially as my name's in there as well.
Thank you. Can you hear me okay now? I'm aware that it was quiet earlier. No?
Yes.
You can?
Yes.
Fine. Brilliant. Okay, so yeah, this is the election of a new board member. We have currently 7 board members, and we have been hoping to recruit. We have now recruited Penina. I'm really pleased that she has agreed to be a trustee with us, and just wanted the members to also vote for Penina to be one of our trustees. Would you be okay to put that into the chat, and we can carry on to re-elect some standing directors? If you don't mind doing that now. The biography for Penina was sent out last week. It's on the website as well, and I think we were going to have it in the chat box. I'm just going to check. Thank you, everyone, for the. That's brilliant. Okay, so we have that part. So Penina, welcome. It's great to have you on board, and I know you're here with us, so that's brilliant. So now we have the re-election of 3 existing directors. Obviously, their election does come up every few years, and today it's for Lance Allen, Dick Whittington, and Georgie Big. And again, can we just for all 3 of them at the same time, so that we don't spend too much time doing this? Assuming you are happy for those current directors to be re-elected. Georgie is obviously the chair. Could you put that in the chat box as well?
I'm just putting their biographies in.
Oh, thank you.
As well.
So biographies, yeah, that's a great idea. Thank you very much.
So you can just take a look at those.
Those unfortunately did not get sent out, but they were on the website. I think they didn't get put in the papers earlier last week. Thanks very much, Maisie.
And just Georgie's to go.
Thanks, John. Thank you, Justine, for voting. Raquel, lovely. Diana. Thanks. That looks like we have that already as passed too. So that's brilliant. Thank you very much, everyone. We're going to be going back to Georgie for a moment, and then we'll have a presentation. Thank you.
Thank you very much, Vicky. Could I have the next slide? Thank you. Thank you, Maisie. We have had a number of questions before the meeting. We asked for questions before the meeting, and we have actually had 5 questions. We've got 2 up here that I'm going to ask Dick Whittington to cover as they relate to finances, and I'm sure he can answer the second question as well. So I'm passing over to you, Dick, to answer those two questions from the public.
Thank you, Georgie. And the good news is that I remembered to unmute myself this time. I think I touched on a bit on the first one
Yeah.
when I spoke. As I said, I think our reserves at around about £50,000 are adequate as things stand. As far as this year is concerned, I'm fairly confident at the moment, unless we decide to spend more money on additional things that we feel we need to do, we should come in well under budget for the current year. So that will actually start to push our reserves up. There's, you know, it's not like some voluntary sector organisations, let alone private companies. We have to be a bit careful because our lovely friends in the local authorities get a bit edgy if they see our bank balance getting too high, but of course they give us most of our money, so there's a balance to be had there. But equally, we do need a reasonable cushion to manage the ups and downs of the year. In terms of the slightly increased income, yes, there is a prospect, but it's very difficult to say at the moment. We've been assured nationally by Healthwatch England that additional money has been made available for Healthwatch. Healthwatch is by the government, but the problem is that local authorities, as I'm sure people know, are under an enormous amount of pressure on cash at the moment, not least because of the of COVID-19. So I think it might take some time for us to get a result of that, but we would certainly hope to see an increase in income. Not that we're desperate, but I think the message is that there's an awful lot more that we need to do, and we need the resources to do it. So I hope that's okay. And first, in respect to the first question, the second one, I think I can be briefer. Because we're a charity, we are formally trustees, but we are also a limited company, as we need to be because of the risks that otherwise face us. And as a limited company, we're also directors. So everybody on the board is both a director and a trustee. And whether we call ourselves director or trustees tends to depend on who we're talking to, but I suppose in general we refer to ourselves as directors. Okay.
Thank you very much, Dick. Thank you for that. And we'll publish these questions alongside some published answers as well. As I mentioned, we had three other questions. They're a little more detailed and broader than I think we can do in this particular meeting. But what we want to do is to note those questions formally and provide a written answer. The three of them are in chat at the moment, should you want to look at them. The first two are quite broad in their approach, and I think it probably be helpful for us as well to talk with Healthwatch England over those. So I'm intending to contact Healthwatch England for a national response on those, as well as giving some thought to a more detailed formal response. So I hope that's acceptable to people. They'll be posted on the website once we have the responses. The fifth one, it talks about communication, and unfortunately it says that the person's experience is poor, and that it's not effective or inconsistent. We have a number of ways in which we work with people. We work obviously with the public and with patients. we do work directly with commissioners and staff of providers and their staff. We're actually doing some work at the moment that brings us in much more direct contact with a couple of the projects that we're doing currently. We also have a means to use the feedback that's given us to prioritise our work. And we're trying to improve, I think, as Dick indicated and Vicky has indicated so far in what we've reported to you, the way in which we communicate. Obviously, during COVID, we've had to do that more remotely, virtually, and not on a one-to-one basis. But we've been working hard as well to work with the voluntary sector. And you'll see that some of our work, we've worked directly in signposting individuals and families to the help that's available to them. I'd be interested as well to understand what you would like from us. So if we could, if anyone wants to send to us some ideas in which we can do things differently, if it's at all possible to do it, we will. You know, our work is all about trying to improve the patient and service user experience. So it's really important to us. So we will try and detail that. And just really to illustrate how we've been doing that, we've got a presentation this evening from Ruth Greene from BS3. As I said, we've been working with community groups, and Ruth is going to talk to you about her work at BS3. So I'm going to pass you over to Ruth. Thank you very much.
Thank you, Georgie. Hello, everyone. Thanks very much for having me, and congratulations on a seamless AGM to date. It's very impressive. I've been to a few, and honestly, this is up there. So top marks, lots of effort, and really well chaired. For those of you that don't know me, and probably most of you, I'm Ruth. I'm the Community Development Manager at BS3 Community. We run 2 community centres in South Bristol, the Southville Centre that's been there forever. It's a old Victorian school. And then the Chestnut Center, which is our new centre that opened also in Bedminster 3 years ago. As with everybody, come the end of March, things changed very dramatically. So our centres closed. Our main revenue is through our nurseries. So we have 5 outstanding Ofsted nurseries on our sites. We were able to keep those going short term for key workers or key worker children. But then obviously when everything went into lockdown, they also had to close. We had phenomenal support from families that carried on paying a retainer throughout that period. So a small percentage to ensure that their children could return to us as and when we could reopen. And we actually reopened our doors to children, so those same families, in June. Our centres, here we are, mid-October, our centres still remain closed. It's horrible going down. I only go down probably once every fortnight, and it's really horrible. The energy and the life of the centres has absolutely been sucked out by you know, we had a really vibrant cafe, we had a really busy reception team, and phones were ringing and people were flitting about everywhere, and of course it's changed massively. I think you know, as Georgie touched on, I'm a glass half full kind of person, and I think for me, even though COVID has thrown up a huge amount of challenges, it's also thrown up a huge amount of opportunities, particularly for the voluntary sector. I think the voluntary sector has always been fluid and, you know, able to duck and dive in a professional way, and you know, that's been proven through this crisis, really. So before I talk through the slide, I did just want to acknowledge our kind of improved relationships with other organisations like Healthwatch, with other organisations like so North Somerset, Fiona down at North Somerset, Fiona Cope, our colleagues in South Gloucester, we're working with Southern Brooks, and then partner organisations across the city like Southmead Development and Wellspring and Knoll West. So we really are, we feel really strong. We feel that we're being listened to by some of our statutory colleagues, perhaps more than we would have been. And I think some of that is absolutely down to the amazing response that the voluntary sector. So I don't know if everyone can see that slide. The colours aren't very clear, but this is a slide that I put together actually for a South Locality Partnership Board. So that was a BNSSG Partnership Board. And interestingly, the voluntary sector weren't invited. So we, with our newfound big boots, we decided that we would ask for an invite. So we were told that we could have one representative for the whole of BNSSG. So we went back with our big boots and said, well, actually, Bristol and North Somerset and South Gloss are really different. You know, Bristol's different enough across the postcode areas, let alone our peers and colleagues in North Somerset and South Gloss. So we stomped in with 3 sets of big boots. So we had representation from all of the localities, which was fantastic. And we all presented a slide very similar to this. So this was BS3's community response. And it was 100 days of COVID. I'm not sure what we're on now. I've stopped counting. I don't think it's a healthy pastime. But just talking through, so the pink box at the top, food. So we set up in partnership with the local church. We set up a larder that was for emergency response. So Fair Share were delivering excess food, and we were sending out emergency food boxes to families in the BS3 area. So particularly useful for people that were economically vulnerable, obviously, but also for people that were shielding and didn't have any neighbours or family close by that could help. We've since set up a food club, so that's in partnership with Family Action, so demonstrating again our kind of new networks and opportunities throughout COVID. So we run Bedminster Food Club every Friday out of a different church hall on West Street. That's the United Reformed Church Hall. And it's a different model in the sense of it's still supporting people that are economically vulnerable, but it doesn't have the stigma attached to it that a food bank does. It's a food club, so you're a member, so you pay £1 for your membership, and then you pay £3.50 a week for a box of food that's about what it's worth, about £15 or £20, and it's food that's donated from Fair Share. So as of last week, we were week 7 last week, and we've now got 40 people signed on that come along at a time slot to pick up. Next, we've got prescriptions. So this was for anybody that saw the term drugs runners in the media. It went a little bit mad. It kind of went on the news in America and Australia and all over the place. But essentially, there's an online Facebook forum called This Mum Runs, which, as the name suggests, is a group of mum runners, and they talk about running being obviously good for mums in the exercise sense, but also in a headspace sense, and just having time for yourself. As everybody went into lockdown, obviously mums had to make the decision: do I go to the park with my children for an hour, or do I go for a run and stay sane? So we spoke to some local pharmacists. They had an issue of being able to get drugs out to people that were shielding. So we brokered the relationship between This Mum Runs and our local pharmacies. So the mums were able to go out with a key worker status, pick up a prescription and take it to Mrs. Jones, who was waiting for her prescription. But it also meant, importantly, that mum could still go out for her hour a day, as Boris prescribed, with the children, so the family weren't suffering. So that was a really nice sort of brokering responsibility or relationship that we helped with. Meals on Wheels, not much to say really. We support lots of older people in our community. We've run a Monday Club for the past 30 years. So our charity is 30 years old. Actually, we had our birthday in September. We had all sorts of wonderful things planned. And we ended up sending out a little Zoom and the senior management team singing happy birthday to the staff. So not really what we had planned, but Meals on Wheels essentially was about us working with some local community partners of various ethnicities, making sure that people had a nice hot lunch on a Sunday. If they might normally go and see friends or family on a Sunday, or go out with friends for a pub lunch. So we were supporting people, particularly our older friends, as I said, in the community. Social prescribing, for people that don't know about social prescribing, BS3 community secured the agreement. Oh, I've got a question. I'm terrible at that. I always look at the chat when it pops up. It's completely thrown me, Jeff, now. I've got a section for questions at the end. Where am I? Social prescribing. So we employ link workers. So part of my team, I have 4 link workers in my team. They normally would sit in a GP surgery, and essentially social prescribing is about reducing inappropriate non-medical presentations to GPs, so freeing up GP time. That obviously has a benefit to society and the NHS pocket and GP time, but it also has a huge benefit to the individual that's being supported. You know, that's been going really well. A huge amount of people that have come through with increased anxiety, and you know, whether that's around job losses or COVID generally. The others are you know, pretty self-explanatory. I think I'm probably nearly running over time. I did just want to come back to Jeff's question. We didn't have any issues at all with regards to the prescription pickups. People were DBS checked, so the runners were DBS checked and took along ID. And in certain situations, they would have a letter from the person that they were picking up the prescription on behalf of, or a telephone call. So I mean, I think there was some relaxation of rules around COVID because it was an emergency situation. I didn't get involved in the nitty gritty, but I know that it absolutely worked, and it worked very well. I was just going to touch really quickly on volunteering if I've got the chance. So in BS3 we had 1,152 volunteers at peak, which was a huge amount of you know, a real upswelling from the community. 6 months on, we're still at about 300 volunteers. So they are the wonderful people that are doing shopping for people that can't, picking up prescriptions for people that can't, doing checking calls for some of our elderly or less mobile friends. So it's been challenging, but lots of opportunities. So I'll wrap up.
Thank you very much, Ruth. Thank you. And a lot to cover.
I could go on for hours.
Well, a lot to cover in a very short time. So I mean, I want to thank you for all the work you've done, and for working with us up until now. And I hope that you continue to work with us in the future. And all those other groups out there. I mean, we are working with them right across the piece. So it's really good to hear from you, and thank you very much. Thank you.
Thank you.
We've heard from Vicky about the work that we've done earlier in the year and before for our annual report, which would have been at the end of March. But the team now are going to tell you a little bit about what's going on at the moment. So I'm going to pass you over to Julie, who's going to tell you about some of the work in Bristol.
Good evening. I'm Julie Bird, and along with my colleague Achomo, a lawyer, we represent Healthwatch Bristol as the area leads. One of the most important tasks this year has been the formation of strong reciprocal relationships within the community. Prior to the COVID lockdown, we were privileged to be able to do this through numerous personal visits to many local and diverse organisations. These included Borderlands, the Carer Support Centre, Rethink in St Paul's, the Avon Food Bank, the Royal British Legion, Barton Hill Settlement, Brunel Care, Headway in Fish Ponds, Womankind, Beloved, the Red Cross at Warmley, Ambition Lawrence Weston, Helping Bristol's Homeless Project, Walking with the Wounded, and the Carers Cafe at the South Bristol Community Hospital. We've continued to initiate and develop those partnerships digitally, and this enables us to represent citizens and inform them of important local health messages. We are excited about working with the community and sharing opportunities for project partnerships in the future, and as well as being able to get more coffee and biscuits as soon as we can get out. I'll now hand you over to Achomo, who will tell you about our work this year. Next slide, please, Maisie. Thank you.
Do we have a Chomo with us? I know she had some Wi-Fi problems earlier. Chomo, are you there?
I'm so sorry. The noise is bad. Anyway, my name is Achomo, and thanks, Julie. For our projects, we conducted Enter and View at Elgar House in South Mead in February this year. We also conducted Care at Home Pulse survey during COVID-19. We collated over 100 feedback from Southwest region and presented it at local dental network meeting. At the moment, we're looking at mental health support for dementia carers for vulnerable groups. We have represented Healthwatch Bristol across meetings and forums, prioritizing the patient voice, including locality and regional meetings. Our engagement have included telephone surveys, using online surveys and QR codes. We've been doing shared views, animated links now on websites of 8 Bristol GP surgeries. That's digital, and we have also used Twitter and Facebook. We have developed good relationship with social care providers and funders and Bristol Health partners, including Dementia HIT, Stroke HIT, Babcon HIT, Dental Work with Bristol University as part of their steering group. We've been involved with many voluntary sector groups. We have signposted the public to the public to during the COVID lockdown. We continue building our networks and ability to influence, presenting our work at Healthwatch and wellbeing boards and scrutiny committees, championing citizens' views, supporting those in need, and helping to improve services. Thank you.
Thank you very much. I think there's oh, that was the Ruth one, sorry. So we're moving on now to hear from Maisie in South Gloucestershire.
Hello everyone. As Georgie said, my name's Maisie. I'm the area lead for Healthwatch South Gloucestershire. I wanted to just give you a bit of an update on the project that I'm undertaking, which is looking at learning disability annual health checks. Across the patch, there's inconsistency from GP practices into the information that is given to people before they attend their annual health check. So we've kind of identified a gap there and are working with the clinical commissioning group, South Gloucestershire Council, and Serona to create a set of pre-check questions that can be sent out to people with learning disabilities to basically help improve their annual health check. It will include loads of different things, as well as some kind of reminders about medication, weight. It will include some information around healthy eating, and one of the biggest things is to do with the amount of water or liquids that is drunk, because one of the highest levels of death in people with learning disability comes from constipation. So we're kind of pulling together all these different bits of information and resources to not only improve uptake of the annual health checks, but also hopefully improve the health check for the individuals themselves. So just a quick overview of all the different people we're working with. One of the key things with this project is that I am holding focus groups with people with learning disabilities, and also running a steering group, which is involving parents, carers and supporters. So I've got these kind of two strands of patient voice and input. I'm definitely looking to speak to more people. So if anyone has any ideas or suggestions, do get in touch. But so far, I've spoken to about 5 people with LD and a couple of different parents and carers. It's a really positive project. We're going to get support from the CCG to roll it out across South Gloucestershire. So that's really, really wonderful. It seems to be quite an exciting thing that has got a lot of people interested. So we're really pleased.
Thank you very much, Maisie. Thank you. So we're going to move on to Chile then, and Chile's going to tell us about her work in North Somerset.
Yeah, Good evening, everyone. My name is Julie Diodis. I am the area lead for North Somerset. I'm going to talk a little bit about one of the projects we run as a result of the lockdown. So during lockdown, we concentrate most of our efforts to support our residents, especially those who have been identified as vulnerable to the COVID-19. So during the lockdown, we support around 130 residents. They are all shielding or self-isolating due to the pandemic. So they call us mainly to get information about the services, or also to be signposted to support they needed, like for shopping or getting education or getting transport to hospitals. So by the end of lockdown, we contacted 70 of these residents who had previously called us to take part on a phone survey. So the aim was to get feedback about their experiences, especially around of seeking information and guidance related to COVID-19, about the effect of lockdown on their well-being, the support they needed, and how satisfied they were with the support they received. Of those 70 residents, then 45 agreed to take part. The main findings of the survey indicated that around 25% did not have access to the internet, but even some who had access to the internet, they didn't know how to use it. Around 30% had changes in the delivery of their healthcare. This included from appointment in council, the regular checks-up or test, or the care that they used to receive at their homes. 63% felt isolated or lonely, and they said that this affected directly their well-being and mental health, and also impacted on their physical health. And 90% that received support they needed from the volunteer in the community, they were very happy with the support they received. So based on these findings, we made some recommendations. And at the moment, we are exploring with Community Connect through Jade Ines, then I think she's attending our AGM. So the idea is to publish an easy step-by-step guidelines on how to access internet, and also some of the health apps that can help them maybe get some information at home. And also together with a visual physical activity booklet that they could do some physical activity at home. So this would be especially for those who are more isolated. If you'd like to know more about this survey, you can read our report on our website, or if you want to contact me directly. Now, yeah, okay, thank you, Maisie. So a part of the survey, we have also been working on the project. So early this year, we carry out an interviews observation at Grand Road Surgery and the Horizon Health Center. The result of this observation, probably you have seen, were on the first page of Western Mercury in July. And if you want to know more about it, also you can read the report on our website. At the moment, we are also running 2 project surveys around mental health support. These projects, they are part of our 2020 work plan. One of them, we are running co-production with We Are With You. And the aim is to find out about the support needs of those with dual diagnosis of mental health and addiction. This is the first time a survey is being doing specifically for this group. The survey has been carried out by phone calls, and we're also trying to do some face-to-face with those very vulnerable groups, including some homeless people. The other survey that we are currently running aims to evaluate the support for those with long-term mental health problems from community mental health services since the lockdown. So both the surveys, it just says they were co-designed with people with lived experience of mental health through online focus group that you've been running. So I hopefully we will have the report for both services by December. And finally, we have carried out our daily work with patient information site posting. This year, you have already logged about 119 pieces of feedback. And this feedback, they are shared locally and nationally. Yeah. Next slide. Crazy.
I think the next one's just going back to Georgie.
Yes.
Sorry. Okay. Yes. So that's for me there.
Thank you.
Yeah. So I hand it up to Georgie. Yes.
Thank you very much, Chile. Thank you. It's a lot to pack in a short time, isn't it? I'm just going to summarise really, because I think a number of you have heard that a lot of our work involves giving information and signposting, and this was one very pleasing recent piece of feedback, which I'll leave you to read for yourself. But it's really good when people come back to us and we know that they've got what they wanted, which has been the intention of some of those surveys that Chile has mentioned as well. So we tried to track what we're told by patients, service users and their families, and look to see what the result is. So we're really pleased with this one. So I'm going to now move on to the final slide. And just, I think they're all here in the background, but we haven't heard this evening from a few really important other people in the team, and that's Julia Senior Smith and Rachel Tomlinson, who both look after our volunteers. So that's a job share. And from, we haven't heard from Rebecca Jones, because unfortunately Rebecca is not well at the moment. But I really wanted you to see the whole of the team, because although we're not in face-to-face situations at the moment, you know, they are there on hand. They've all been working so hard. And we have got a couple of other people who are working with us at the moment on special projects. You heard about the some of the health teams that we're working with, and we've got a couple of other people. Heisey Andrews, who's working on the Stroke Health Partners projects, and Jill Reeks, who's working on the Bladder and Bowel Health Partners project. So we're really pleased about those. They're all been very busy, either very carefully social distancing or getting up to speed with virtual, as we've all had to over recent times. So I want to thank everyone in the team, particularly the staff, but also, of course, all our volunteers. At the last count, I think we've got 36 volunteers. We'd like more. So if you're interested in volunteering, whether it's ongoing or for a short period of time, for a specific piece of work, we often have short projects that you may be able to help on, things that match your interest. So please get in touch with us. And also, of course, my colleagues on the board, and a particularly warm welcome to Penina, who's joined us just recently. We are advertising for more board members, so do look out for that as well. So thank you very much for joining us this evening. And remember, we will be posting all this on our website and giving responses to those questions that you asked. Thank you ever so much, everyone, for attending. And thanks to the team.